What's going on, guys? Welcome back to the PT Coffee Cast, brought to you by The Movement. My name is Dalton, and alongside me today is my beautifully bearded friend, William. William, how are we doing today?
I feel like for the first time in PT Coffee House history, your beard is actually longer than mine is.
We're just having back-to-back iconic moments here on the PT Coffee Cast.
Woo!
Last episode, we try our first PSLs. This episode, my beard is longer than William's beard.
It's crazy. Like, I don't know if you're just gaining more wisdom or what's happening, but
I'm definitely not gaining more wisdom.
we are back to the normal coffees today.
We are. I have not had any pumpkin spice type things since our last podcast.
I think it's a special occasion thing
Yeah.
for me and you know? Maybe we'll have the anniversary next year.
Yeah, my brother was telling me that you can get like a cold brew version of like something like that. He sent me a text. I didn't tell you this, but he sent me a text before, and he goes, don't drink the PSL. He's like, it's not good for the brand. He's like, drink this, and he sent me some cold brew like Starbucks to get. But I was like, nah, this is good for the brand.
Well, I want to try that. So if we get that pumpkin whatever cold brew,
Yeah.
count me in, man.
Okay. That could be sometime down the line. We got a lot of
Sound
fall.
good?
We got a lot of fall left.
All right, well, cheers to that, eh?
Cheers. All right, guys. Thanks for tuning in. If you aren't subscribed to the podcast, make sure you do that on your podcast platforms. We dropped a new website, which we're super stoked about. That is going to house basically everything PT Coffee Cast and the mentorship. So if you want to get anything with regards to this podcast or the mentorship, head over to themovementmentorship.com. Will and I have put in some effort over the last 2 months to get that up and running, and we're really excited about it. And it's just another extension of what we're trying to do and develop with the podcast and the mentorship. So if you guys want to check that out, please head over and do so. And then if you want to see our beautiful faces, you can subscribe to the YouTube channel so you can see these video episodes as well as some clips and whatnot that we post out on the YouTube. But for today, we are diving into a new series. We're going to have a slow drip of clinical questions that Will and I like to ask. And we're going to share them with you and give you a little bit of context around what we get out of asking them and what we've noticed that it does with regards to like connecting or communicating with clients throughout their time with us.
I'm ready to go.
Yeah.
Ready for the slow drip.
That slow drip. So there's going to be a series of these. I don't know how many we have in store, but it's going to be more than one, which we're excited about. So why don't you introduce what the question that we are going to talk about today is?
Yeah, so this is one of my personal favorites. It's something that seems to come up often in the mentorship as we're going through. But the question is, let me just make sure I say it right.
Yeah, there's a lot of pressure.
Okay, it's what do you think about this movement? And movement could be anything. So it could be a squat, it could be lifting overhead, it could be bending your ankle, it could be whatever is relevant for that client.
Okay. Yeah, I love it. Maybe we start with why that verbiage specifically. Like, is that intentional?
Yeah, so I think it kind of comes from the place of, I can't remember when we were talking about it, but we were talking about how we always ask, like, how did that feel? How did that feel? How'd that feel? And you just find yourself like asking that question so many times in a session.
Yeah.
And so that's where the intention comes is I want to get at what they think. I want to get at their cognitions, you know, and what's going through their mind when they go through a movement. Are they confident about it? Are they scared of it? Is it something that's come up in the past? Do they have specific questions about that movement before or maybe after I asked them about how they felt during it?
Yeah. Yeah, I agree. I think I know I can be a broken record sometimes. It's like, how did that feel? So I think switching it up is good and trying to get their perspective on like what they think about it. Is there a ton, like, are you asking that with every movement, or are there certain times, like, are you intentionally putting that question in conjunction with a particular movement that you've kind of picked up on as being something that someone might have some thoughts on, or is that something you just ask when you have them do every single movement that you do?
I think it's not every single one. That would get pretty crazy if you're asking them that, and how do you feel after every movement always, but I think it's more from, it depends on the conversations that you're having with that person, and kind of maybe what you've gathered. Maybe you have a little hunch on something that might come up, based on the way that they're describing their injury and whatnot.
Yeah, for sure. I think being intentional with that, and this kind of comes back to a lot of what we talk about on the podcast about connecting with the client, asking their why, not rushing through the assessment, and maybe pulling on some threads that people are presenting that might indicate that there might be some fear around that movement, or there might be some confidence around that movement, or whatever that's being brought up prior, to then bring it back into that objective movement assessment. And then I think asking that question at the right time can really help tie a lot of that together if you are tactically setting up the way that you do those things. And I think there's a lot of value to being aware of that as a clinician, and in practicing implementing those things specifically.
Yeah, as you were kind of talking there, I sort of thought, like, it's kind of when you want more information, when you actually, or you want them to bring stuff up, because it could be also later on, because you're seeing that they seem more confident and you want them to actually verbalize that. So there could be like a lot of different times when maybe it's appropriate, but I think in general it's like when you want more to talk about. I think you can also just get them to bring up questions in a way that's like, and we talked about this before, but specifically by saying, what do you think about this, versus like, do you have any thoughts about that? What do you think about this implies that they are thinking things.
Yeah, it's like implied that there are things going through their head,
Yeah.
which is good, because most of the time there are things going through their head, and then when you imply that there's something there, then they'll share with you, versus like what you just said.
And then oftentimes, like, let's just say like a squat, it's stuff like, where should my feet be, or like, I didn't know whether my knees should go over my toes, or like, I didn't know, like I noticed you bent over a lot more than I did. Like, should I be bending over? Like just things that like are only going to come up if you're actually like prompting more discussion about them. You might not even, there might be things that you've never heard before, like, but that's where actually getting into like their thoughts and their cognitions is really helpful.
Yeah, and I think like we can maybe do a little bit of an example, or I had an experience just actually yesterday with a client that one of the benefits of asking this question did come up, but a lot of times when I ask that question, I'm implementing it for trying to get a couple things across. Like, I definitely will tie it to fear-based movements. So when I'm picking up on the fact that someone is concerned about a particular movement, and then we're going through the assessment, I will expose them to different variations of what they're afraid of, and I will ask them what they think about it, to see if they're connecting the dots of like this being related to their fearful movement, or if it is the movement itself, are they really afraid of doing it? So I think that's one big piece that you can get out of it, is like around fear.
You're getting them to like explore the idea of like why they're afraid of that movement, and maybe help them experience and see that they don't need to be as much. I'm curious, when you do that, do you find sometimes that you go back to the thing that they were afraid of and they can actually do it?
Yeah. A lot of times I do that if I'm clinically seeing like, oh, this is really just a fear-based thing, and like there's nothing physiologically or from a tissue standpoint that is going to prevent them from doing it, I will start to slowly implement different movements to get them to do that movement that they're afraid of, and then I'll ask them what they think. And a lot of times they don't put the two things together, that the movement that I just made them do is a movement they're actually afraid of. So for example, like deep knee flexion, I'll have them do something that will put them into deep knee flexion without them really realizing it, and then ask them what they think about it. And then if they connect the dots, that's cool. If they don't, I will help them connect the dots. And I think that is huge, and a very good way to like implement that question.
And then circling back to the original question, it's like by understanding their thoughts, you're actually, and exploring that, you're actually seeing that, oh, they are afraid of this. Like, well, why are you afraid of it? Like, you can, like you said, pull on that thread.
Yeah, and then that can often take you very deep, but can really, really change the trajectory of rehab like really quickly. This doesn't have to be on the first assessment, but it could be. And so yeah, I think it's an important thing to do and pull on.
That's awesome.
The other thing though is like it can also be implemented to like enhance confidence or have them express confidence, because sometimes I'll pick up on movements where people actually like feel confident in, and I'll ask them what they think about it, and they'll be like, yeah, I feel really strong in that movement. And then I'll ask them, well, why do you feel strong with that movement? And they go on to tell me more and more about that, which is also like a really good thing to pull out, because a lot of times people actually don't give themselves enough credit and don't highlight the fact that they're actually really strong at movements,
Yeah, it kind of like brings up like what you said there sort of got me thinking. Like, I often follow a what question with a why, so it's sort of like, what weight do you think you should get? Like, if they're like, oh, I feel really strong in this movement, well, what weight do you want to pick? Do you want to pick the 20 or do you want to pick the 30? And they're like, I think I want to pick the 30. And you're like, why do you want to pick the 30? It's like a what question followed by a why question, and then you get that insight of like, I just feel like I'm a lot stronger than I was, and like I want to grab that bigger weight.
Yeah,
yeah,
that's
interesting
cool.
way to like kind of have that follow up.
And even just that conversation is very powerful, even if it doesn't go anywhere from there, right? Like that, them acknowledging that is very, very powerful when someone's trying to like rehab from something.
Because like you said, the reason I brought that up was it's not always about the decision making. Sometimes it's about highlighting or having them actually verbalize and realize, not just coast through and be like, good, I'm happy that they're lifting more or whatever, but them actually being like, oh, like I remember when I wasn't thinking like this and how held back I was, and now I'm picking the bigger weight, and my therapist is noticing that, right? And you're like getting that like, hey.
Yeah, and I'm going to go on a side tangent here, and then we're going to get to one more thing, but that, in my opinion, is clients being active in their rehab. So we talk a lot about being like having an active approach to care, and I think a lot of times people think that is solely about movement, and it's not just about movement. That whole scenario that we just talked about, that is being active in your, like having active care for a client, involving them in the process, involving them in the decision making, highlighting things, making them feel hype, having them get hype about it, or have them question you about it. Like that's active in your rehab, and it's separate of just movement. And I think that people get that misconstrued sometimes when they're like, oh, like I take an active approach to care because I have people do squats. It's like, well, yeah, that is an active approach, but there's more that I believe that goes into that. And I think that is also what we just talked about.
100%. It's almost like you're picturing there's this cloud of like all these things that could potentially be barriers to them achieving their goal ultimately. And you're trying to work with them to explore what those things are, and then help by what you're doing and maybe what you're coaching them through. How can you transform those things so that they allow you to move forward?
Totally. And then the last part about that question, and this is what I just had happen with my client yesterday, was you can learn if they have the ability to do this movement at home. So I had like a client do a high box, like lateral step down. Like I think we were doing it on like a 12-inch box. And we're going through it, and he was doing pretty good at it. I'm like, well, what do you think about this this movement? And he goes, yeah, like it's definitely working, but I have no idea how I'm going to do this at home. And so then we started to brainstorm a little bit about how he could do it, and he literally just didn't have anything to do it. And so I was like, okay, well, let's try this variation that elicits a similar response in a different way that you can do at home. So I think it also provides you with information on how they can do it at home, which is ultimately how can they be consistent with this movement outside of what we're doing here.
Yeah, that's a really good point. And I think sometimes you just get into things and you don't necessarily think of something, and that's totally understandable. Like, we're not like perfect, right? And so by like asking that question, you might unravel that this is actually not going to work.
Yeah.
And then you can pivot versus just like going, how does it feel? Fine, sweet, let's move on to the next thing.
Yeah, and then he got 3 extra sets out of it.
Yeah.
Because we just went through 3 sets of this movement, and then I was like, oh, okay, well, let's try this movement. And then we did 3 sets of that movement. So you got a little extra work out of it too.
Love it.
But yeah, I think that was good. Let's I know we wanted to keep it to like 15 minutes, but I feel like we went longer than that.
Could be, I don't know.
But we'll wrap it up there. The question in this series of questions is, what do you think about that movement?
Boom.
Okay, guys, thanks so much for tuning in. If you want to follow us, make sure you subscribe on all podcast platforms. Follow us on Instagram at PT CoffeeCast. Check out the website, themovementmentorship.com. You'll find all things mentorship and podcast there. You'll find the link there to schedule a call and fill out an application for our next cohort for the movement mentorship. We are still looking for people to join that. If you find value in this content and you want to dive a little bit deeper, get a little bit more guidance, be with a dope group of people, have some coffee, learn, grow, develop, mentorships for you, sign up, and we can tell you a little bit more about what that looks like. But that is all we got for today, guys. As always, stay caffeinated. Peace.